Welcome to Marksman Targeting.
The laser light is in line with the bar, so you can see the laser kind of shining down the bar. So everywhere the shadow of this on the x-ray is, the laser shows you on the skin where it is at any angle.
Okay.
Right? So I'll bring back to zero, everything to zero. And you can see here I've got degree markers.
Right.
Okay, so we'll start off with finding midline. So Eddie, can you bring, I'll palpate for the spinous process, and I'll feel them there. So I'll say bring the C-arm in between my fingers. And he can see now, see how the line is here?
Yep.
So he needs to wag this way with the base, and then bring the whole telescope in towards me. Okay. Keep coming. There we go. Okay, stopped right there. Now, I felt the spinous processes, so I don't necessarily need to take an image, but if we did, you'd see the line going straight up the image. So based on the preoperative planning, why we go all the way to the skin, which we didn't talk about, is I can measure from the midpoint over to where it exits, and say that's 4, 5, 2, 1 centimeters where it exits. So we're going to say we're going to go out 3 centimeters, or to my finger. And he has centimeter markers on the thing. But like I said, the doctor's driving this, so I can say, you go to my finger, or if we do have the luxury of having that, we go up to there. Okay, and so we figured 20 degrees. So come over 20 degrees. And so between the distance from midline that we calculated and we should be pretty close to targeting the pedicle. So we'll be on a Scotty dog image. So I can step away. And go ahead and take a shot. Okay, so we're looking for L4. So we're a tiny bit medial. So I'm going to go a little lateral to that and make my line just lateral to that. So we're good to go there. So what I didn't do is mark my midline. Okay, so bring it back up to 0, please. And then bring it back in 3 to midline. Keep coming. There we go. Okay, close enough. We'll rotate this 90 degrees. So we can step away again, zero bedside shots. And bisected the pedicles in this orientation. So we'll make, geometrically, that's our starting point. So now the the spotter comes in. We need to first put this on the intersection. We'll line this up. So with one push, by keeping the ellipse or the eclipse and me at 20, my head would normally be over there looking at it. So I'm just, until I make contact with the bone. I let it go. You can see the
depth markers.
The depth markers, but you can also see how the laser's kind of off, right? If I take an x-ray, I'll see the reticle line and the shadow of the needle will be crossed. Because it's not oriented. So before I do that, I'm going to make an adjustment. So that's a little closer. Are you trying to cross,
I mean, obviously, are you trying to cross the white segment here or the center of the green segment there?
So I'm trying to go from the base of the needle to there. I mean, it's just a little bit of a, this is foam and everything. Normally a doctor would have me come in here with a coker, but I'm going to say I've got a little purchase in the bone. There's enough depth where it's not going to wobble too much. There's not a lot of weight on the needle. So I'm going to say that the needle tip is going to be a little inferior, but that's okay. We'll take another shot just to confirm where we're at. You don't have to be here. So you see the shadow of the needle in reference to the reticle across there. And again, I'm inferior, so I can tell I'm inferior with the line. So I use my proprioception and feel there. And I can take the mallet, start it, not pop back out, hold, Okay, now you can still see that there's a little bit off, but we'll take a shot. The starting point's still there, but I don't have to be here. And when I do take the mallet, I'm going to make my correction. Mallet in the right plane.
Yep.
And it's coming in.
It should be lateral or even a little
It's
down a little bit.
coming a little bit, yep.
Take a shot.
So it's following that. I want to steepen it this way and go this way, just to overcorrect a little bit. It'll snap back perfect right into alignment. And if it's perfect there, perfect there.
Yep.
So you don't have to take the shot. If you get wrapped up into the line over the line,
Right.
you can tell that before you take the shot. If you know it's crisscrossing, it gives you a reference on which way to go.